Hello, it's Dr. Tampa here. I hope you're all keeping well. Today we're going to cover why we only have 10 minutes for appointments and who actually decides on giving only 10 minutes and what GPs can do in that time. So please share this video with as many people as you can. Comment below with your own personal experience of 10-minute consultations and any encouragement and or other topics you'd like me to cover in our future episodes. When seeking to understand what GPs do on a day-to-day basis to justify having only 10 minutes, it can be quite difficult for most people. This is often because most people don't use their GPs that often or have a true understanding of what it makes a GP a GP. Also because there are still lots of misconceptions and misunderstandings about the role of GPs within the NHS and private clinics. To give an example, there's a long-running joke, a long-standing joke amongst me and my family and some friends that all GPs do is prescribe paracetamol for everything. So no matter the nature of the complaint or the severity of the problem, the GP will confidently and unerringly prescribe a course of paracetamol to work its magic. Now, some of you may have had that personal experience yourselves, or you may agree with that idea, but anyone who's got any significant illness of any kind or who has been ill for any period of time will know the true importance and the real value of having a good GP or family practitioner. It can make the world of difference. So the misconception that GPs are limited in what they know and understand can be easily sort of comprehended in the light of what I mentioned earlier. As a doctor myself, having worked in the NHS for over 12 years, and a GP working in urgent care settings, out of hours, general practice hubs, and various clinics and surgeries all across the UK for the past 7 years, I can confirm that primary care, and GPs in particular, have a very difficult job and do a lot of the heavy lifting and hard work that often goes unseen and unsung within the NHS. I would even go so far as to say that a large part of what GPs do isn't known. The GPs do a lot of rapid assessment, diagnosis and management of all acute and chronic disease. But a lot of the work is also risk management and gatekeeping, as well as clinical governance, research and audit, patient and staff education, resource management, and clinical leadership. So GPs wear a ton of hats and do all sorts of work. But essentially, it's all about providing and maintaining primary care services by improving levels of care and monitoring individual staff and practice performance to make sure they meet the required standard. So apart from just dealing with coughs and colds from little Johnny or little old ladies and other minor ailments, GPs provide robust medical assessment and see upwards of 20 patients per session in every 3 to 4 hour long clinical session that they have. They then deal with all the urgent and routine letters and correspondences for their registered patients, and this can be 1,000, 2,000 patients. And after this, they respond to all the blood imaging results or other investigations for their patients, and then resolve any home visit requests for that day. So as you can see, the role of the GP is sort of multifaceted. And a lot of what people don't realize is that GPs have a big role in public health screening, such as antenatal 6 to 8 baby checks and postnatal maternal checks. They also help to organize child immunization programs, which help prevent many infectious diseases and their long-term complications. GPs also give contraception advice, and some will insert coils and hormonal implants. They also manage the full range of chronic diseases by working in close partnership with specialists via organizations such as MDTs for cancer or palliative care, for the dying, as well as many other enhanced services. That's why 10 minutes is often all the time that's left available for the appointments after sort of discussion and organisation between the GP and the practice managers. GPs are especially trained to assess one problem within 10 minutes and come up with the safest and quickest treatment and management plan according to the best practice, current evidence-based medicine and clinical need for that individual patient. Now, some surgeries will offer more time, but most only offer single appointments of 10 minutes. Occasionally, if you can get more time, but only if you need an interpreter or you've got too many problems to deal safely within a 10-minute time frame, or your problems are too complex. However, most problems can be assessed either face-to-face or over the phone in a 10-minute slot. Usually because the GP will know you and have all your information to hand. And a lot of the time that they spend is subsequently organising investigations and any referrals or treatments that are needed following that initial consultation. The problem we currently have is directly related to supply and demand, not enough doctors, overwhelming demand, and this is being compounded by the current COVID-19 pandemic, which is also meaning waiting times are even longer, and GPs are struggling to cope because of that increased demand. So appointments, treatments, investigations, referrals are taking so much longer to organise because of issues with the NHS. And some people are resorting to travelling overseas, we call travel tourism. And even worse, they're having to resort to, Dr. Google or just taking advice from unscrupulous or ill-informed individuals. Through the private clinic that I run with my team, we aim to provide the full range of primary care investigations, referrals and services that will help people to increase their options, to save time and money, and to navigate the overwhelming treatment and referral options that are out there. So please, contact us today at Iano Medical BPC on our number, which is 0208 017 1296, for a discussion about the range of services that we offer to cover the needs of you, your family or organisation. Thanks again for your time today. Thanks for the attention. And until next time, stay healthy, live long and prosper.